When it comes to pelvic floor dysfunction, we are so focused on the pelvic floor as if the floor is living by itself. The floor is the floor of the inside of the pelvis connected to the walls. It is a reinforcement on the inside part of this wall because the pelvis is the foundation to this structure. If the foundation is unstable, anything above is in jeopardy. If the foundation is not strong, what is connected to the foundation, your lower extremities, is going to not be stable. Instability in that area means the safety for you, means falling. Your brain is dying to make sure you live a long life and your life is safe and pleasant given what you throw at it. So, when it comes to pelvic floor dysfunction, focusing on just the floor, in my opinion, is just such a small portion of what needs to happen. Your joints, your pelvic stability, and your feet, and your neck, they all have to, they're connected. Your temporomandibular joint, which is where basically your head is, lines up, and it has a really strong relationship with the very first vertebra in your neck, where your head gets connected to your neck. There are receptors there that have to connect and communicate with the pelvis joint, and the two together then relay the info to your subtalar joint. Your subtalar joint then has to, based on what it receives, it has to translate that info to your forefoot for balance and coordination. So once again, if you have pelvic floor dysfunction, it is not just the floor. It is your whole being, and your feet have to respond to what's happening or not happening above to translate it into your midfoot and forefoot so you can better balance yourself. Because at the end of the day, if you don't balance yourself, you are going to be unsafe. I hope this made sense to you. I hope you understand that pelvic floor therapy needs to be pelvic floor dysfunction assessment and whole body mechanics. That may not be the answer you're looking for, but that's the reality that us as clinical rehab clinicians have to address. And like it or not, as the owner of the body, you gotta be paying attention to. If you have pelvic floor dysfunction and looking to see how we can help you, use one of the methods of contact in the description box. Follow us on social media, educate yourself on how your body moves, and I promise you, you will be in a better place. Until next time, take care.